Every year, over 49 million Americans aged 65 and older go to the doctor for a routine checkup. But what most of them don't realize is that some of these very tests could actually do more harm than good. From scans that expose you to unnecessary radiation, to screenings that lead to risky treatments, you'll be surprised at how common these are. Today, we're breaking down 5 routine checkups that might be putting your health at risk. And you'll want to stick around for number 5 because it's one test still recommended for millions of people, even though its dangers are hotly debated. Number 1 on this list is the annual chest X-ray. At first glance, it seems harmless. A quick snapshot of your lungs and heart, no needles, no pain, and you walk out thinking you're taking care of yourself. But here's the hidden truth most seniors never hear. Chest X-rays are incredibly common for people over 70. Doctors often order them just to be safe during routine checkups. But what you might not realize is that each X-ray exposes your body to radiation. And yes, radiation, even in small doses, adds up over time. Repeated annual X-rays, year after year, quietly increase your risk of cancer, especially lung cancer. It gets trickier. These X-rays often reveal tiny shadows or spots on your lungs that are completely normal for your age. But the moment a shadow appears, alarm bells go off. Suddenly, you're referred for CT scans, biopsies, or even surgery, all for something that might never have caused a problem. Take Margaret, 74, a retired school teacher who had always felt healthy. Her doctor ordered an annual chest X-ray. The results showed a small shadow. Within weeks, she was undergoing a CT scan, a biopsy, and countless hospital visits. In the end, the shadow was harmless, but the stress, medical procedures, and side effects left her weaker than before. So what's the smarter approach? Listen to your body and focus on symptoms, persistent cough, unexplained shortness of breath, or chest pain, rather than routine yearly scans. If you feel well, skip the annual X-ray. Lifestyle choices like quitting smoking, staying active, and getting vaccinated against flu and pneumonia protect your lungs far more than a routine photo ever could. Remember, what seems like a simple precaution could quietly put your health at risk. Annual chest X-rays may appear routine, but for seniors, they're a classic case of more isn't always better. Number 2 on this list is the full-body CT scan. On the surface, it sounds like the ultimate health precaution. A high-tech, detailed scan of your entire body, designed to catch cancer and other hidden illnesses before they become serious. But here's the harsh reality most seniors don't know. Full-body CT scans expose your body to massive amounts of radiation, far more than a standard X-ray. Just one scan can equal hundreds of chest X-rays. For seniors, this level of exposure isn't harmless. Studies now suggest that repeated scans may actually increase your risk of developing cancer, sometimes triggering the very disease you were trying to prevent. And there's more. These scans are extremely sensitive. They pick up tiny nodules, calcifications, or harmless cysts that are often part of normal aging. Once detected, these abnormalities can set off a chain reaction of follow-up tests. PET scans, biopsies, and sometimes surgery. And each procedure carries its own risks: infection, bleeding, or even organ damage. Let me tell you about Marcus, an 80-year-old martial arts instructor. He felt strong, active, and healthy. But during a private full-body scan, a tiny nodule was discovered in his lung. Within weeks, he was referred to oncology, underwent a needle biopsy, and ended up in the hospital when part of his lung collapsed. The nodule, completely benign. The scan didn't save his life. It almost cost him months of his health and freedom. So here's the key takeaway. Full-body CT scans for healthy seniors without symptoms rarely save lives. They often create unnecessary fear, stress, and dangerous procedures. A smarter approach is to focus on symptom-driven scans, only when there's a real reason, and to invest in preventive lifestyle measures. Regular exercise, healthy eating, staying hydrated, and avoiding smoking. Quick question for you. How many CT scans have you had, and have you noticed any pain or discomfort afterward? Drop your answers in the comments. We love hearing your experiences. Full-body CT scans may promise safety, but for seniors, they're a classic case of the cure can sometimes be worse than the risk. With that being said, let's jump to the number 3 on this list. Routine blood tests. Just in case. Blood tests seem harmless. A tiny needle, a quick vial of blood, and you walk out thinking you're staying on top of your health. But here's the part most seniors don't realize. These tests can sometimes create more problems than they solve. Doctors often order routine panels, checking cholesterol, liver, kidney, and other markers, even when you feel perfectly healthy. While the results are meant to be helpful, false alarms are common. Slightly elevated numbers can trigger unnecessary prescriptions, more tests, and stress, sometimes leading to real side effects like digestive issues, dizziness, or weakened immunity. Take Henry, an active retiree who never had any major health problems. During a routine blood test, one value appeared slightly off. Within weeks, he was on medication that caused severe stomach irritation, fatigue, and even mild kidney strain. The test didn't actually reveal a dangerous condition, but the treatment left him feeling worse than before. Here's the truth. For healthy seniors over 70, routine blood tests without symptoms or risk factors rarely prevent serious illness. Instead, paying attention to your body, unexplained weight changes, unusual fatigue, or new pain is far more effective. Your doctor can order targeted tests only when needed, keeping you safer and avoiding unnecessary medication. And if you've made it this far, that means you love what you're watching and want more tips that protect your health after 70. Hit that subscribe button now and turn on notifications. We post content like this regularly to help seniors stay safe and informed. Routine blood tests may seem safe and smart, but for seniors, more isn't always better. Sometimes, less truly is more, especially when it comes to protecting your health. Number 4 on this list is routine EKGs, or electrocardiograms. EKGs are one of the most common tests ordered for seniors. A few sticky patches on your chest, a machine that traces your heart's electrical activity, and a graph that looks like a heartbeat on a roller coaster. It seems simple, quick, and harmless. But here's the truth most older adults don't hear. For people over 70 who feel generally healthy, these routine tests can actually cause unnecessary anxiety and lead to interventions that may do more harm than good. Minor irregularities, which are extremely common with aging, can be flagged as abnormal. Once flagged, this can trigger further testing, stress tests, catheterizations, or even stent placements. Each procedure carries real risks: bleeding, infection, kidney problems from contrast dye, or heart complications. Consider Raymond, a 75-year-old retiree who walked every day and felt perfectly fine. During a routine checkup, his doctor recommended an EKG. The results suggested a minor irregularity, and he was immediately scheduled for a stress test and then a catheterization. During the procedure, he experienced kidney strain from the contrast dye and spent nearly a week recovering in the hospital, all for something that wasn't life-threatening. His fatigue never changed because there wasn't a serious heart problem to begin with. Here's the key insight. EKGs are excellent tools when you have clear symptoms like chest pain, shortness of breath, or significant drops in energy. But for routine, symptom-free screenings in seniors, they rarely improve outcomes. Instead, they often trigger a domino effect of tests and interventions that can leave an older adult weaker, stressed, and at higher risk of complications. A safer approach is simple. Maintain a healthy lifestyle, manage blood pressure and cholesterol naturally where possible, stay active, and monitor any genuine symptoms. When there's a clear reason, targeted testing can be life-saving. But using EKGs as a routine insurance policy for seniors over 70? It may quietly do more harm than good. Routine EKGs feel safe, but for many seniors, they are a classic example of well-intentioned medicine gone too far. Less truly is more, especially when protecting your health in your later years. And we saved the crazy one for last: the PSA test, or prostate-specific antigen screening. For men over 70, PSA tests are often recommended to catch prostate cancer early. The idea sounds simple: a blood test that checks for elevated PSA levels, signaling a potential problem. But here's what most seniors don't know. PSA testing can be far more complicated and risky than it seems. PSA levels naturally rise with age, infection, or even minor prostate irritation. One elevated reading can trigger anxiety, repeat tests, and sometimes unnecessary biopsies. These procedures carry real risks: bleeding, infection, urinary issues, and in rare cases, sepsis. And the truth is, many prostate cancers found in men over 70 are slow-growing and would never have caused harm during their lifetime. Take Walter, 78, a retired accountant. His PSA came back slightly elevated. Concerned, his doctor recommended a biopsy. The procedure caused bleeding and infection, leading to weeks of recovery. In the end, the cancer was indolent. It was never going to threaten his life. What started as a preventive measure ended up reducing his quality of life unnecessarily. Experts now suggest that PSA testing in men over 70 should not be routine, especially for those in good health without symptoms. Instead, decisions should be individualized, considering life expectancy, overall health, and personal preferences. Lifestyle measures, maintaining a healthy weight, exercising, and a diet rich in fruits and vegetables have been shown to reduce prostate cancer risk far more safely than routine testing. The takeaway is clear. The PSA test, while useful in some cases, is not always the life-saving tool it's advertised to be for seniors. More testing isn't always better. For men over 70, less can be far safer. And that wraps up the 5 health checkups seniors should be cautious about after 70. At Dr. Wells Explains, our goal is to give you clear, science-backed information that helps you make smarter choices about your health. Remember, more tests don't always mean more safety. Sometimes they quietly create risk. We want to hear from you. What health topics or tips do you want to see next on the channel? Comment below with your ideas and experiences. We read every single one and use your feedback to make the content you care about most. If you found this video helpful, make sure to subscribe to Dr. Wells Explains so you never miss our latest tips, guides, and health insights for seniors. Stay informed, stay safe, and remember, your health matters most.